Hi, my name is Allison Mann. My policy proposal is regarding the use of seclusion and restraints in the state of Washington for both children and adults in the behavioral health setting. I am a charge nurse currently in an adult inpatient psychiatric facility that does utilize seclusion and restraints. Our patients are detained on an involuntary basis for the purpose of evaluation and treatment. Our patients can be unpredictable and aggressive at times, which poses a unique challenge for the nurse, who must maintain safety while also protecting the patient's individual rights. The targeted audience for this proposal is the Washington State Department of Health, who is responsible for proposing the creation of or editing of existing regulations, such as these that affect the health of the general public. Current regulations are not adequate to protect patients. These practices continue to pose a threat to patients' psychological and physical safety. According to the Joint Commission, restraints alone cause approximately 1,240 serious deaths or injuries per year in the United States. Although these practices are supposed to be only utilized in emergency situations as a last resort, they are often overutilized and generally avoidable. My policy would increase oversight, monitoring, and patient safety. It would create safer conditions for patients by increasing staff awareness of the risks of seclusion and restraints, the regulations, critical prevention, and early intervention strategies, such as de-escalation techniques and emphasis on less restrictive measures. The focus would be on creating a therapeutic environment that minimizes the chances of conflict. And when conflict does occur, it will give employees tools for managing the situation and minimizing harm. The facilities would be required to implement a program to formally reduce the use of seclusion and restraints, which would include mandatory staff training. There are a number of free resources with comprehensive training that have been proven to be effective. Every facility would be mandated to maintain records on all seclusion and restraint incidences and report them to an outside agency to be published on the state's website. Seclusion and restraints would also be defined under separate headings. They are different practices with different sets of considerations. Each intervention would be addressed separately with respect to safeguards and time restrictions. The purpose of this proposal is to create safer outcomes for patients and a safer work environment for staff. The serious risks involved with these practices cannot be refuted. We must aim for reduction and eventual elimination of these practices, which demands the need for more stringent regulations at the federal, state, and organizational level. We cannot justify harming consumers when we are supposed to be helping them and offering healing and hope. Thank you for listening.